Tanisha,
Good morning, Chairman. We're ready to begin.
will you do the roll call, please?
Yes,
Or have you already?
I haven't.
Okay, please do.
Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
Anthony Williamson,
Here.
David Cruz,
Here.
Nelva Lee,
Here.
Cynthia Rucker,
Here.
Russ Childers,
Here.
Kenneth Davis.
Here.
Chairman, that concludes my roll call.
Thank you, Tanisha. And we have 100% participation this morning and really appreciate all of you taking your time from I know our busy schedules to participate in our special call here this morning. We have one item only that will be asked for consideration for initial adoption is on our agenda. But at this point, we do have obviously a quorum, and I'll call the meeting to order. And I'll go to the commissioner for her comments, if you would, Commissioner Nagle, please.
Good morning, Mr. Chairman, members of the board. Thank you so much. Really no update for me today. Just as you all know, as we talked about briefly last week, CMS issued this guidance that coverage for clinical trials was going to become a requirement of state plans on January 1st. So we appreciate your flexibility and willingness to work with us on getting this meeting called so scheduled so we can get out to public comment so we can meet that timeline. I've really just been in awe and thunderstruck of the staff and how quickly they were able to pull this together and get some of the financial projections done. So kudos to Lynette, to the finance team, and everyone else for getting this ready for us today. So thank you. That concludes my remarks, Mr. Chairman.
Thank you, Commissioner. With that, we'll move right into discussion of the Medicaid coverage of routine patient cost. And Lynette Rhodes, Executive Director of Medical Assistance Plans, will make a presentation. So Lynette, would you please proceed? Thank you.
Thank you. Good morning, Chairman, members of the board, and Commissioner. Thank you for the opportunity to present. Pending approval from the Centers for Medicare and Medicaid Services, the Department of Community Health is proposing to modify its state plan to allow for coverage of routine patient costs associated with participation in qualifying clinical trials for Medicaid members. As Commissioner Nagle mentioned, on December the 7th, the Centers for Medicare and Medicaid Services issued guidance to state Medicaid agencies regarding mandatory coverage of items and services associated with a clinical qualifying trial. Specifically, the guidance directed state Medicaid agencies to cover any item or service provided to a Medicaid member who is participating in a clinical trial. This includes any items or service to prevent, diagnose, monitor, or treat complications resulting from participation in the qualifying clinical trial, to the extent that the provision of such services or items would otherwise be covered outside of the course of participating in a qualifying clinical trial. States may not deny coverage based upon the location of the qualifying clinical trial, even if performed out of state. Additionally, states may not deny coverage on the basis that the treating provider or principal investigator is out of network. Federal regulations define a qualifying clinical trial as a clinical trial in any phase of development that is conducted in relation to the prevention, detection, or treatment of any serious or life-threatening disease or condition. Additionally, a clinical trial must also be one or more of the following. The first is a study or investigation that is approved, conducted, or supported by one of the following entities. The first is the National Institutes of Health, the Centers for Disease Control and Prevention, the Agency for Healthcare Research and Quality, the Centers for Medicare and Medicaid Services, a cooperative group or center of any of the entities described, or the Department of Defense or the Department of Veteran Affairs. And finally, a qualified non-governmental research entity identified in the guidelines issued by the National Institutes of Health. A qualifying clinical trial also includes a clinical trial approved or funded by any one of the following entities: the Department of Energy, the Department of Veteran Affairs, or the Department of Defense. A clinical trial may also be one that is conducted pursuant to an investigational new drug exemption under Section 505I of the Federal Food, Drug, and Cosmetic Act, or an exemption for a biological product undergoing investigation under Section 351A3 of the Public Health Services Act. Or finally, a clinical trial that is a drug trial exempt from being required to have one of the exemptions in the previous bullet. The guidance from CMS also identifies items and services that should not be covered by state Medicaid agencies. This includes any investigational item or service that is the subject of the qualifying clinical trial and is not otherwise covered outside of the clinical trial under the state plan. Additionally, routine patient costs do not include any item or service that is provided to the member solely to satisfy data collection and analysis for the qualifying clinical trial. In terms of the fiscal impact, this change is estimated to increase Medicaid expenditures for state fiscal year 2022 as follows. Total funds represents $3,474,589. Of the total funds, state funds represents $1,044,114. Federal funds represents $2,430,475. This change is estimated to increase Medicaid expenditures for state fiscal year 23 as follows. Total funds represents $7,168,078. Of total funds, state funds represents $2,420,660, and federal funds represents $4,747,418. Chairman, I will pause now for any questions from the board.
Are there any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Russell Crutchfield will move to pass.
Mr. Crutchfield has moved to pass the approval. Is there a second?
Russ Childers.
Russ Childers has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved for initial adoption, Lynette, and we'll look forward to getting the results of your public hearings that will be scheduled in our normal process. And I'd like to add the board's thanks to your staff for preparing this for a special meeting today and providing us as a board all the information that you did in advance so we had a chance to review it before today's meeting. Thank you very much.
Thank you, Chairman.
Does anyone know of any new business that needs to come before the board at this time? Hearing none, the meeting is adjourned, and wish everybody a Merry Christmas. Thank you very much.
Merry Christmas.
See you next year.
Thank you.
Christmas.